tell me about this Petersen paper and what is the implication and what is the impact?
Well, in 2009, the World Health Organization convened what they called were the stakeholders, and there were in fact a broad array of stakeholders, -2 categories, but not only was the Dental Association there, UNEP was there, and that's good. A number of dental professors were there of mixed views, but that was good. And the environmentalists. Michael Bender was there, Elena Lambieri was there, that was great, and Lars Highlander was there. So it was a pretty diverse group. Now missing was the mercury-free dental groups. So there were no mercury-free dental associations there, and missing 2 were the dental patients. Michael coined a word that may not even exist, and it was a brilliant move. It was called phase down. I'm not sure that's in a dictionary, but the meaning's pretty obvious. He couldn't get agreement on phase out, so he suggested let's phase down amalgam, and the dental interests agreed. I mean, it's a step, which was a consensus word that the dental associations would agree with. The World Dental Federation and their ilk, and the World Health Organization, everybody agreed to a phase down. Bender was both excited but skeptical, and he immediately issued a news release saying there's been a phase down, and told me he was issuing a news release because he said that he was afraid they'd retract it. So the word got out immediately, and WHO was very upset. He said that because they said the official minutes aren't out. Well, he wasn't going to wait on that. And in fact, the official report didn't come out for a year later. That's what was, they waited. Everybody kept waiting. And the WHO guy who said at the meeting, I'm going to write up the notes, this is very exciting, we're going to talk about phase down, he instead assembled 3 pro-mercury dentists like himself and issued a report ostensibly about the meeting, but it wasn't about the meeting. It was about how there's no way to phase down, amalgam's safe. Basically, it was a whole different, it was a mythological report that claimed to be a report of that meeting. And Bender, Peter Maxson, Lars Highlander, Elena were furious because they said this is absolutely false. So what we learned later was UNEP was equally furious. So the question was, how do you translate that into getting that report withdrawn? So that was the challenge we faced, Bender and I and others faced a couple months ago. So we had the report. They had the report, and it was a disaster, so I called it the Petersen Paper. I sure as heck wasn't going to let them call it a WHO report. Now the reason it came out was, it came out to impact 2 events, the treaty and the FDA hearings.
The cost of restorations for children alone would increase by $13 billion over a 15-year period. Such an impact on dental costs and access to care would be acceptable only if amalgam posed harm, but it does not.
I noticed my memory was deteriorating, weight gain, my thinking lacked clarity. I was truly in disarray. I saw Dr. Atkins. He took one look at me and said, "You're toxic."
That means you take the mercury out, the level oral mercury vapor inhalation in their body goes down to 0. It may not get them healthy, there may be permanent damage, but the future exposure to mercury is down to 0 once you get these fillings out.
The National Dental Association supports the continued use of dental amalgam as a safe and efficacious restorative material.
Immediately, this report, which was partly written, or maybe generally written, by an American Dental Association dentist from Texas, he was one of the authors, it was used by the ADA at the Food and Drug Administration hearings to say WHO report says it's safe. So it was timed, it was politically timed. It was a political propaganda in favor of mercury fillings, and it was timed to have the stamp, the imprimatur of WHO, to influence the Food and Drug Administration hearings and to influence this treaty. And they thought they could get away with it because they've gotten away with it many times before. They got away with it 10 years ago with this committee report that turned into WHO policy, which it never was. So it was a game they played before, only this time it didn't work for them. I mean, they ran up against us and we were ready. Michael insisted we marshal forces, and Michael and Peter Maxson, the economist, Lars Highlander, and Alf Benson, who was not there but really got involved. And then we corralled our people. And our people got going big time. And I asked, and then I called it the Petersen Paper. I asked, Marie Grossman wrote these very aggressive letters in French. Servando Perez Dominguez, our first vice president, wrote letters. Juliet probably wrote a letter. And do you write a letter, Lillian?
And where is Petersen?
Petersen's in Geneva. He's the in-house dentist. He's the Susan Runner of the WHO.
Like, why isn't he here?
Oh, I think he's intimidated. There's no way he'd have come after this. Oh, he'd have been eaten like a, he would have gone through the meat grinder here. The WHO held him home. This is a victory for us that he isn't here. WHO does not have, Carolyn Vickers didn't come back. The people that they brought to that arrogant Carolyn Vickers who went to Stockholm and said, and told me, she told me, she was sitting on the edge of her chair because she wanted to leave talking to me as fast as she possibly could. She's like talking to me now like her feet are trying to start moving and leaving as we're talking. And she said, WHO does not set, policy is set at WHO by the 190 nations, not by the staff. She was lying. She knew she was lying, and she knew that I knew she was lying. Because I knew WHO policy was set by the in-house dentist, and she knew it was set by the in-house dentist, and darned if the Peterson paper didn't prove it. So anyway, we went after him, but even the letters weren't doing anything, probably, according to somebody at UNEP, excuse me, whose name was, I've forgotten, who said that it was when we went up the ladder. I mean, I wrote the Assistant Director General, he didn't answer, so I wrote the Director General and the General Counsel. So the Assistant Director General, Alwan, wrote back and said, I'm going to do an investigation. And we kept piling on the letters and kept laying it out, the case against Petersen, how it was so irresponsible, it was propaganda, it was ruining the good name of WHO, they never checked with people, and the letters just poured in aggressive, very well-written letters from around. Now, we also were able to get letters not just from kind of the, if you will, the European insiders. The letter came in from Indiac, the Lebanese NGO. A letter came in from Jeunes Volontaires pour l'Environnement de la Côte d'Ivoire, Dominique Bally. Letters came from a lot of places. Letters came in from New Zealand, Juliet Pratt, and letters came in hammering this guy from the United States, saying this is really unfair and it's costing WHO its reputation. So we learned this week that the Petersen paper has been pulled, it's being totally rewritten, and there'll be input from Bender and all the participants. Now, is it going to be a better paper? Yes. Is it going to be a good paper? Maybe not. But the point is, it's time to celebrate an effort where Petersen overreached, and part of the impact of his overreaching is he's not here. And another part of his overreaching is he is not going to keep making policy at FDA, at least not for a while. Now, if we let up, he'll regain control. So we can't let up. That's what happened at FDA. Runner lost control, she regained control when we let up.